First of all, thank you very much for joining on Sunday. I know it's a busy day for most of you. So those of you who are working in surgical scrub caps, good on you. I think you're taking a significant effort in making this session, and I'll promise I'll make it count for everyone. Although it's a bit challenging to adjust everyone. Someone's driving. I just saw that. Maybe I didn't believe my eyes, but I just saw someone driving. So hello, that's Dr. Ananda. Thank you very much for joining. So, look, from wherever you are, welcome. I have got a few sort of things to say before I formally start the session. First of all, I'm going to do a little presentation, not a PowerPoint. I've drifted away from that model. I think it's just too monotonous. I'll keep it as much engaging. So you have to see my face and listen to me unbearably for hopefully an hour. But the presentation will only last for maximum of 15-20 minutes. Um, the other thing is that after the presentation, we'll have a Q&A session based on the Q&A session of the last time. I think that's where the real value is, and you obviously all have questions. I'm hoping that most of the questions would be addressed in those presentation key points, but obviously if somebody still has got some points, then yes, that will be adjusted. Now, because you are all deliberately muted, it's because sometimes, I've got people complaining about uh, there's a background noise, so I've muted everyone. But when I start taking the questions, I'll unmute you. And the reason I'm going to take this is it will be in a systematic format, because if I unmute everyone, then there'll be a noise and it'll just, it'll just disrupt everybody's experience. Now, I'm getting plenty of requests about the recording of the session. I am recording the session and I will release the session on the YouTube and on Facebook, and you will have the recording, all of you, along with the key summary points, hopefully. So let's just have a quick look at the waiting room again, because I am unfortunately doing everything myself. And I have to do the housekeeping. I think I had the setting on that everybody can join automatically. I don't have to add them on physically. Anyway, the other thing is that, so we've talked about muting and unmuting. So when you want to ask a question, you just raise your hand and I'll unmute you, and then you can ask the question and then I'll mute you back. And again, it's just to keep the session flowing in okay. Now, let's just move into the presentation part, which is just going to be myself talking. This is not a PowerPoint presentation. I think you've got plenty of people talking about the PowerPoint aspects and everything. So bear with me for 20 minutes and I'll try to be as much explicit and quick. I've already made my points and notes. So in this presentation, I'll be talking about the application with regards to the specialist assessment process, by and large, which applies to most of the colleges, which is RACP, RACS, RANSCAR of radiology, dermatology, ops and gynae, pediatrics, and all the allied specialty. And obviously, if I'm missing some key like some major specialty, please do let me know, because now we are pretty much doing every college assessment, having had successful outcome with most of the colleges. I'll then move in and talk about the documents, which is another crucial part of the application. I'll then shed some light on the interview process, because that seems to be now coming more in fashion. The colleges are relying too much on an interview, despite how adequate or inadequate, rather, I say, your application is. The interview is now weighed quite heavily. So we'll talk about how heavily is it. Is it 60% or 70% of the entire assessment process? And then we'll talk about the elephant in the room, which is the jobs, because none of this matters if there's no job. So we'll talk about the job strategies in terms of short-term training and about the specialist jobs. How long does it take? What specialties are in demand? What specialties are causing a lot of time? Is it random? Is there some, meaning to this madness? And then we'll open up for Q&A session. So let's move on. Look, some of the changes which has been key changes, which I'd like to make sure that I get them out of the way very quickly, is that there are more scrutinization, if that's a word, or scrutiny of the documentation. And there's now heavy emphasis on interview. And in most ways, it's more pleasant. And in some ways, it is not so pleasant. I'll talk about the pleasantries first. So, some of the applications which I honestly did not think would go ahead, and my advice was then, your chances are perhaps 50-50. And I've just received an outcome from radiologists from Santiago in South America, and she was found partially comparable, despite having some serious issues in her application, which I highlighted. And she's been engaged with us for about a good part of a year and a half. So I'm constantly learning, and I think that goes on showing that the assessment is actually on training rather than exclusively on training duration, number of years. It's the components matching which is becoming too light. And obviously, interview plays a huge part when all of these key components are need to be explained. Um, the other thing is that the overall assessment, the specialist assessment, is a perfect synchronization of three key issues. There's an application, there's documentation, and there's an interview. And as always, as I say, that it's actually the perfect synchrony. You cannot say something in interview which you've not highlighted in your documentation, which you've not said in your application form. If you say, I forgot to actually add that point in my application, or I did not have that experience during the time of the interview, the college will not have a bar of it. They're just not bothered. They want you to be as much specific and detailed with your application inputs, also with your supporting documentation about those inputs. So when they're questioning you in terms of your training, in terms of your consultant experience, whatever it might be, everything makes sense. And that's consistently the people who do very well in their applications. All right. So let's move on to the application. So first and the foremost, the application process is by and large same for all colleges. College of Physicians, College of Surgeons, College of Dermatology, Psychiatry, Radiology, Emergency Medicine, Anesthesia. These are the bulk of the applications. Dermatology, pathology, psychiatry, it's exactly the same. In fact, pediatrics and RAC, pediatrics and Ranscar have exactly got pediatrics and physician has got exactly the same form. In fact, pathology have also got exactly the same form, but the component systems are quite different. So application, if you're thinking about lodging a specialist application, which I would encourage everyone who are thinking of coming to Australia and specialist pathway, you need to make sure that you are, first of all, eligible for it. Eligibility has been a major issue of failure, of people not realizing that they are eligible for that particular specialty, be it radiology, be it surgery or allied or medicine. I'll give you an example because I think these kind of things are better served by a specific example. So as a blanket statement, I'd like to say, if you have got 5 years of training, and on top of that, you have got at least 2 years of consultant, you're looking safe, at least from the application point of view. I'm not talking about the documentation and the interview. If your training is less than 5 years, if your consultant experience is less than 2 years, it's not the end of the world, but now you have to jump through hoops. Okay. And this application is already on a shaking grounds. And I'll explain to you how. So, for example, you say that there's no training program in Pakistan or India or Bangladesh or majority of the participant, which is 5 years long. FCPS in itself is 4 years. Maybe if you do cardiology, there's a basic cardiology training and then interventional cardiology training that becomes, 6 years of some sort. And if you do MD and then DNB, then it becomes 5 years. But how do I match for that 5 years of training? So then there is various ways of addressing this issue. Obviously, there's a fellowship, there's a senior residency, there's some compensation from your consultant experience. So there was a very unique application from a pediatrician, which was lodged. And that application, the college, in fact, replied back and said that in order to compensate for the lack of your training, we would expect your consultant experience to be more than 3 years, because the training program was 4 years in Bangladesh. So there are ways of addressing that. Now, obviously, the 5 year training program historically has been through for the people who are coming from South Africa, the people who are coming from UK, the people who are coming from Canada, which have, if you look at the statistics of APRA, they are the bulk of the people who are doing these applications. So there are the ones who would get substantial comparability because their college training program back home in their own country is exactly the same, the duration is same, the components same, the kind of hospital that they work as trainees and consultant afterwards is also exactly the same. So I think for person or an average person who are now applying for the specialist pathway, who are coming from the developing country, we are already actually on a shaky ground. So we have to make sure the application is quite stringent when it comes to this establishing the eligibility in terms of training duration. I hope it makes sense. Now, matching of the training. Now, this is something which I'm constantly learning every week when I deal with all the application. It's not about the actual duration of training. And people, I do these meetings like so many times, and people will say, "Oh, Dr. Rizwan, I have was working in India in one of the largest tertiary hospital. That's like, we've got 3,000 beds in our hospital, and we work like 80 hours a week. Compared to an average Australian trainee, we seeing 3 times the volume of cases." That's not the point of debate. The point of debate is that are you getting adequate supervision through that mayhem which you've just told me? It doesn't really matter if you work 60 hours or 80 hours. If you're not getting adequate supervision, that 60 or 80 patients that you see or operate or do deliveries on, the college is not going to take that argument that your training of 3 years duration is somewhat more superior to the training of 5 year duration. And we've seen this argument pay out countless times when the people try to compensate for the lack of the training of 5 years by saying, "Oh, my volumes are quite high, my hospital is quite big, my experience is quite, thorough." The colleges are more concerned about the supervision during that time. And supervision can always be a bit sketchy when you say, "Oh, I've got a department in which there are only 4 consultants who are supervising like 50 trainees or something like that." So matching the training components is important. Be not too, you know, histrionic in your description of your training, that these are the numbers that I'm operating on, these are the numbers. As long as you've got supervision, even the small number of cases are fine. I repeat, don't worry that your training is inadequate. I've had people getting substantial comparability outcome working in remote parts of Pakistan like Balochistan and remote part of Punjab in Faisalabad, even substantial comparability outcomes. So there's a wide spectrum of what the colleges take into consideration. If you're supervised, if your demographics is what you're serving under that supervision with the key outcomes of learning, with your procedural skills, with your communication skills, that's good enough. That's fine. So match those training components for your college. Um, Other thing which people always ask me is either that I have got no consultant experience, because I can understand the consultant experience is something which is not easy to obtain. It's not immediate. Not many people get consultant jobs from wherever your country are. Even in Australia, it's not easy to become a consultant after you've got your CCT. After passing any fellowship exam, oh, by golly, it took me 3 or 4 years to find a substantive consultant position. So how come we can expect the same kind of standard of having a consultant experience in Pakistan? How can we have the same experience back in India? So I know that there are people who work in a private hospital, what in Indians call it a corporate hospital. In Pakistan, we call it private hospital. If you've got that kind of experience, then please make sure that you need to match that experience to a consultant experience here who's working in private capacity, here who's working in government capacity. It's about matching. Okay. Please to regard that. Now, people often ask me, "Oh, is my consultant experience going to be valid?" Yes, it's going to be valid if it's within the full scope of consultant experience. And people often confuse that. What does it mean by full scope of consultant? Like, as I always say, that it involves all of your consultant duties involving, inpatient and outpatient. And just give me a second. All right. So it's the inpatient duties, it's the outpatient duties, it's the operative spectrum. Now, one thing I'd like to specifically mention is the gynecologist. The people who are working in Pakistan, specifically the gynecologists, they haven't got the full scope of practice when it comes to the laparoscopic experience, the outpatient office procedures like hysteroscopy and colposcopy and contraceptive procedure. And that's an immediate fail. Even if you've got a consultant experience which is 5 years plus, and if you've got training which is 5 years plus, for some reason, if you don't have laparoscopic skills, the college is not going to have a bar of it. Your application is not going to proceed even to an interview stage. I know that historically in FCPS and even in many MSONG program, the laparoscopic experience is quite limited. And if it is, you have to make some allowance to compensate for it. There is FMAS, that Fellow of Minimally Access Surgery in India. There are now gynecologists who are offering their own private laparoscopic programs, even in Pakistan. They're doing, day or 2 day courses. 2 days ago, I was talking to one gynecologist from the Middle Eastern country, and she said, "Oh, do you think it is advisable that I go and do this laparoscopic workshop somewhere in Lahore?" I said, "Definitely. Having something rather than nothing is going to add value. If you're saying that I've got no laparoscopic experience, and they'll have their mechanism in terms of testing you. They will ask you a procedure. How do you do that? What if you encounter that particular complication in during inflation phase or during trocar bleeding or something like that? I'm not specifics to the laparoscopic. I'm not a gynecologist, but they will catch you out. So it is very important to have that kind of full scope of practice, especially if you're a gynecologist and you don't have that laparoscopic experience. Similarly, if you are a neurosurgeon, if you don't have base of skull surgical experience, if you are a radiologist and you're not doing cross-sectional studies, there are many consultant who are working in Middle Eastern countries after qualifying from India and Pakistan, who are now working in an outpatient capacity as a GP. Now, how do you think that will float when it comes to their application? That will not float well. That will not sit well with any college, because now you're completely ignoring the right of a consultant to admit the patient, to oversee the patient, to supervise the management of the patient on day-to-day basis. So that's another critical issue. So matching the consultant experience and matching the training component is absolutely crucial. Now, um, is there worth doing additional fellowships? As I said, there are some mini fellowships like FMAS and some other fellowships from other country. People often go to Singapore and they go to Vienna or UK and do these fellowships. If you're lucky to do them, definitely. And if I tell you one thing, if you have got any training component in form of a fellowship, even after you've completed your primary training program, it has got more saving mechanisms for your application and overall application health than anything else. I have recently lodged an application for one of the FCPS in emergency medicine from Pakistan, who's been working largely in a district and regional hospital, yes, one or two tertiary hospitals, who has got no consultant experience at all, but has got a fellowship experience in the UK. Well, fellowship or senior registrar, whatever you like to call, substantially comparable, meaning no exams, meaning no training. Well, top up training, yes, of 12 months only, but no exams. And he's already got a job here in Australia and no consultant experience back home in Pakistan either. So sometimes these fellowship positions do help compensate for the lack of consultant experience. So if you are lucky to obtain a consultant job, or sorry, obtain a fellowship experience in any country, if it's not your country or even in your own country, you may have to take some pains. You maybe you're living in a small city and there's a fellowship position available in um, in major city, then you may have to maybe take it on part-time basis. It's your own prerogative how you are able to compensate for the lack of that training and the lack of consultant experience. Because I do believe fellowship adds a lot of value. Same goes in with the courses. If you have gotten access to courses of laparoscopy, of arthroscopy, of AO fellowship, if you're an orthopedic surgeon, of basic skull surgery, or some vet lab courses, if you're a surgeon or general surgeon, then please add them. They do count a lot. Now, let's talk about the training components when it comes to filling in the application form. So there are historically two components of training, that's pre-vocational training and vocational training. Now, whenever I see pre-vocational training, everybody sort of understands that I'm talking about the internship. And vocational, whenever I say, everybody understand vocational training is the training that you are doing as a part of your FCPS, MD, MS, you know, training, major training of your specialty. What people don't understand that pre-vocational training is not entirely limited to internship only. Now, historically, back in India, people take their do their internship and then they take a gap year to pass their postgraduate entrance exam, NEET, PG, and what. And similar kind of things happen in Pakistan. That you're working as an RMO in a hospital or a PG in a hospital in an unaccredited capacity whilst you're trying to attempt the FCPS Part One, and that's important because this FCPS Part One, and for them that NEET PG in India is that very essence of the first crucial component of the training assessment, that was your training into the special training program in your country through a specialist or competitive entrance exam. Yes, it was. Was there a training component? Oh, sorry, was there an interview component whilst you were entering? And yes, sometimes there's an interview in some of the hospitals. Now, I have seen certain people getting into the training without any competitive entrance, and that is fine too. That is also okay as long as you're able to suggest to them there was some sort of an assessment process, be it an application, be it a little bit of an assessment of some sort. That, it's not like today I decide I want to be a neurosurgeon and I entered in neurosurgical training. There has to be some sort of guardrail. There's some sort of funneling process to enter into that competitive entrance process. So the point that I'm trying to make from this example, that during that vocational time, you're accumulating gap. And for some people, it's only 6 months, 12 months. That's fine. It's pre-vocational training. Nobody minds as much. But some people, it's, 24 months. And sometimes I've seen people as much as 36 months. That does not look good on your application. If you have not started your training after completing your internship and you're not doing anything for more than 12 months, you need to have mechanisms in place to compensate for that. You must be working in some capacity as a doctor. You have to maintain your registration. And in order to maintain your registration, it's an expectation in Australia level that you are working in some sort of capacity. I don't mind if you're working as a GP. Nobody cares if you're teaching at that same time in as a demonstrator in some college. When I was working in, like, I was studying in Dow Medical College, we had various postgraduate trainees who were teaching, who were our demonstrator of anatomy, physiology, pathology. So, it's completely fine, but please avoid highlighting that as a gap, that it's my gap and I couldn't do anything and whatever. It doesn't look good, and trust me, it then leads to what I call a cumulative effect. You've got one issue, they'll find another issue in a vocational training, then they'll find third issue in your consultant experience. Now your overall application is looking very dodgy. So try minimize these individual issues for the overall strength of your application. um, Now we've talked about uh, the pro-vocational training. Now I would want to move on the vocational training because there has been some issues recently which we have identified as something new. So historically, what has happened that people who have done FCPS and MD in general medicine, I'm talking more specifically about, we were under the assumption, and because there's no direct curriculum to reflect that. So in specific relation to general medicine, the Australian general medicine training experience is 3 years of basic physician's training and 3 years of advanced training, as is cardiology, as is respiratory, as is gastroenterology, as is any other medicine program, even pediatrics. So what we have been doing for the last 4 years, we've been using FCPSs 4 years of training, or MDs 3 years of training, and then utilizing your consultant experience as well as your, SR experience if you're from India, to map out that overall 6 years of training. Now, from this year, I don't know what's happened, which I'm not entirely happy with, is RACP, or Royal Australian College of Physicians, turn around and say, oh, your senior residency experience is not a proper assessment. It's not a proper training. Similarly, they may are now also saying, oh, your FCPS, after your FCPS experience, your work as a senior registrar is not a proper training. So how do we, in fact, there are quite a few people who have come back to me saying, oh, their application has been rejected as non-comparable. What do we do now? Okay. So previously, by the same formulaic approach, we have been able to get them across substantial comparability in few cases, partial comparability in few cases, any comparability in, with the same kind of. Now they're turning around and saying that your SR experience and your senior registrar experience is not a training experience. I don't think this to be the true matter of the fact. If you are working as a senior resident, if you are working as a senior registrar, that is after the completion of your exams, which is the specialist exam, you need to demonstrate that it is in a recognized training position or a hospital, or at least the second option is that you are under a consultant who's supervising you. And trust me, if you are working as a senior registrar or a fellow or a senior resident in whichever country, please get into the habits of downloading dops and mini key access from generic, or use chat gpt or claude or whatever to make these forms to demonstrate that assessment process. So that senior registrar experience, that resident experience, senior resident experience can be shown as an example of a training, because you are doing exactly what a senior registrar or a fellow would do here in Australia. You see, historically, we're just very poor in documentation. And our consultants, who are our references, are even poorer at providing references for you when it comes to the senior registrar or fellowship roles, which creates problem for no one else but you when it comes to the college assessment process. So what we need to do is create a documentary evidence after your FCPS, after your MD, after your MS, that if you are doing a senior residency, if you are doing a post FCPS senior registrar job, you were under a supervision, you were doing some quarterly assessment, sitting in front of your consultant, discussing your training goals, achieving those training goals, attaining new skills, maybe. And I remember quite vividly that some of the orthopedic registrars that when I was rotating in the orthopedic rotation and in Pakistan, some of the orthopedic registrar would say, oh, I'm assisting that surgeon in his private hospital because he's got an arthroscopic experience, he's got a revision arthroplasty experience, which other government setup is not providing me. That's so important. This doctor is actually making an effort to learn something new. By same token, it might be someone who's doing some interventional cardiology work, or some sort of other, EP or electrophysiology work in cardiology, or gastroenterology work in terms of endoscopic experience, or some laparoscopic experience for that gynecologist that we were talking about. So all you've got to do is create a framework or curriculum, and it's not hard. Trust me, it's not hard. All you got to do is download the curriculum of the college which is applicable or which is relevant to you. When you've got the curriculum, that's the training program, the Australian training program, and you see the training components. And if you think that there are certain training components which are missing from your core FCPS or MD or MS training, highlight them, and then make sure that your registrar, senior resident are actually able to compensate for the training experience. So that's the best you could do, right? It's always the case that you can do whatever you can do, and then rest is up to them. And by historical notion, the colleges are more sympathetic and more, they've got more ear if you have shown the complexity and depth. If you don't assume that, oh, look, I haven't got an experience, what's the point of showing it? What's the point of taking that pain of getting that document? I haven't got it. Then you would be reprimanded later during the interview. And the loss is yours. And the loss costs you $10,000 on an average now. For an average Australian specialist application, it's between seven to $12,000. All right. So don't take that chance for a minimum headache. And trust me, like we do hundreds of these applications. And one of the most painstaking part of this application is not preparing the application on behalf of the candidates. They are now encouraged to do that themselves. But it's actually procuring the documents when I make the templates of the document, when I make their logbooks, when I map it out and I get them to sign, then it's just falling apart. It takes a lot of time. So people who do take all these efforts and take the time, it is rewardable, and it is protectable during the interview phase. So coming back to that point, that 3 years of basic training and 3 years of advanced training, you need to, and if you don't understand that, please don't take risk. Talk to me. Send me an email. You don't have to pay me for that. You can send me an email. Everybody knows our email. Everybody knows our website. Okay. Or book in a consultation. There's various forms of consultation you can do, but don't gamble with that much of a money on your behalf. It's just not worth it. Now, so we've talked about the pre-vocational training, we've talked about the vocational training, and we've already talked about matching the consultant experience or the lack of. Now, one thing which plays out rather abnormally is people don't give due emphasis to their teaching experience. And historically, I can understand that you have been doing teaching, and you have as a consultant or as a senior registrar or even as a trainee, you've been doing teaching. Um, but when you put that teaching experience in your application, you just say, "Oh yes, I have been involved in teaching." Um, at an undergraduate and postgraduate level towards intern and medical students. Now, I remember quite vividly when I was doing the consultant interview here in Australia. One of the feedback that we shared all as a consultant group was that everybody is saying that they've been involved in teaching, but or everybody saying they've got a passion for teaching. But what does it actually mean? How is this passion translating into some sort of evidence? Have they been an invigilator? Have they been an examiner? Have they actually taken an effort of designing, fourth year and final year medical student stage exams or final year exams? Have they volunteered themselves? This carry weightage. And trust me, if you're doing that already, get your professor to sign those letters of appreciation for you. Because by God, most of you would be doing this for out of your own goodwill. You won't be getting paid for that. Even as an invigilator, I think for FCPS or CPSP or whatever the Medical Council of India thing you are doing, it would be entirely voluntary. It won't be paid for. And if you're getting paid, it won't be a big pay, as far as I understand. Okay, so moving on, documents. So this is uh, the second part. By and large, there are key documents. There are logbooks, there's letter of support, there's curriculum, there is CPD certificates, and there are training assessment, which we've just briefly touched on. So what are the logbooks? So logbooks are required by certain colleges. For example, if you're a pediatrician, if you're a neonatologist, if you are a respiratory specialist, if you're a cardiologist, if you're a gastroenterologist, if you're a, any of the surgical colleges, emergency medicine college also require logbook. ANSCA, I think, also require, or College of Anesthesia also requires a logbook. Radiology don't ask for a logbook, but if you've got a logbook, well, good enough for you. I think if you ask me, you must have a logbook. And even if the college is not providing or asking for a logbook, have your logbook ready. Now, people often ask me, oh, our college logbook was all online. It's not downloadable. It has been submitted. It's been lost. That's fine. We are not asking you to produce the exact same logbook that you've submitted or lost, or, it's somewhere up in the ether. We're asking you to try, you know, reciprocate that logbook in a college template. So all of the college will have their own templates for the logbook submission. Use that template year by year, and it's a cumulative number. You don't have to produce every day's story. It's a total number of procedures that you've done in pediatrics. Maybe it's putting in a cannula or doing a lumbar puncture or laparoscopy. If you're a surgeon, or arthroscopy, it's a total number of procedures in year one. And then what level of supervision did you have during those procedures? Was it, um, you were, oh, in fact, it's not even level of supervision. It's just say, was this procedure performed independently? Was it observed with your, or assisting, or was it observed? Three categories: independently, assisted, or observed. If you got every procedure cumulatively in a year in these three categories, you're looking okay. Nobody's going to mind that. Same goes for your senior registrar or senior resident experience. Same goes for your consultant experience. Now people then say, oh, who can this sign? Anybody can sign this in your department where you have trained. Okay. And that could be the current director of training. That could be the current consultant who's senior to you. We just need some sort of acknowledgement that there is someone who can, as a third party, can confirm that that is the case. Now, the problem with is that sometimes this is a problem which I would like to share with everyone. Some of you who are working in Middle East, there is a problem that they say, oh, people don't actually help doing the logbooks with ease here. They don't like to sign the letter of support. They hold you hostage when it comes to confirmation if you work. Middle Eastern culture is not very helpful. That's understandable, but at least get someone in your department who's senior, who is your, helpful in that category, because at the end of the day, we have to submit that document. Now, letter of support, let's talk about that. Please do not do letter of support by yourself. It's not what the college is looking for. It's not what you think is a requirement. Have some understanding. It's about your professional capacity work, which must be matched to your capacity of work. So if you are working for 4 years as a training, as a CPSP training, that is what the letter of support would be like. That, okay, Dr. Let's say Silva is in front of me. Sylvia was working as a trainee of Falana Dimkana College from this date duration to this date duration. Her duties included working full-time work or part-time work. And then, her scope of work including inpatient, outpatient, and some operative procedures depending on the specialty. I don't know anything about Dr. Silva. I'm just making it up. Okay. And then some sort of comments around your professionalism, meaning that you're coming on time, you're leaving on time, you've not got any restrictions on your registrations. And then obviously some sort of capacity of your procedural skills and some comment on that. Not more than one page, if two or three paragraphs. It's not like, it's somebody is describing you in a very sort of glorifying details. That's not the letter of support. It's something different. And plus, the other thing is that that letter of support, whatever it's written in that, should be obeying the master document, which is your own training curriculum of the college. So if you're a pediatrician, there has to be a pediatric training component or curriculum of CPSP or MD of your, or Bangladesh CPSP. It should say that you have fulfilled all the training requirement of your local training body. That's a crucial statement in that letter of support. Okay. And I think you should have these documents regardless if the college is asking or not, because once the problems start arising because of lack of interview performance on that day, for whatever reason, I'm not saying that, look, you were deliberately trying to do poor interview performance, but something happened. Something happened on that interview day. At least you've got documentary evidence of proving that. At least you can highlight that, look, I've already provided some documentary evidence. I could not say that in an interview for some panic mode or whatever it happened. And that's your that's your fail back mechanism, fallback mechanism, or fail safe mechanism, whatever you like to call it. So yeah, letter of supports are important, logbooks are important, curriculums are important. Now we call it curriculum here in Australia. You call it training program. Most of the training program. Now, this is a very weird request, which I've seen recently. Oh, the training program should be publicly available. What do they mean by that? That it should be published on the college website. So even if it's not published on the college website, it should be publicly available, either face to face or online or some form, It should be available. So they can do an independent search and find that document. All right. So this is not something which is like a major issue, but I've seen sometimes a comment when it leads to non-comparability outcome. Out of many 20 comments that has led to the non-comparability outcome, one comment would be, oh, that curriculum was not publicly available. Okay, so you can justify that it was publicly available, but it was, face to face. I had to pay the fee to get the document out, or I had to download from a very specific link, which might not be publicly or Googleable link. It has to be publicly available. All right. The other thing they said that the curriculum must be scrutinized by a higher authority. So you would think, and I would think as well, that college or the MD medical college is the highest authority for a training program. Well, it's not. They are actually delivering the training. College of Physician Surgeons are delivering a training. MD medical college where you're training is delivering a training. They're only doing what they've been asked to develop from a higher authority, which could be Medical Council of India, which could be, what is it called these days in Pakistan? The authority, uh, the licensing authority, which has changed several names over the last couple of years, PMDC or PMC, whatever you'd like to call. So Pakistan Medical and Dental Council, Medical Council of India are overall, the top of the food chain people which are responsible for governing this program. And they must scrutinize these programs. Now, why am I saying that? I'm saying that for a very good reason. I don't think that this thing is applicable to as much in Pakistan, but in India in particular, there are many private medical colleges. You can actually buy a seat in private medical college to train as a neurosurgeon, as a gynecologist, as an orthopedic surgeon, whatever. And some of these programs, they might not be very stringently audited every 3 months, every 3 years, or every 5 years. And if this program is never heard of, the college will pick it up and will come back to you. Oh, can you share the document? When was it last audited? Your training program, your special medical college, or your special hospital when it was. I remember that when we were working in Pakistan, there used to be CPSP training committee, which would visit the Department of General Medicine or Department of Orthopedics and Neurosurgery, and all the professors will come and they'll eat chai and samosa, and it will be all the whole department will look lush push. The whole department will look shiny and everything. That was an accreditation process. So you may not have realized that, but that is an accreditation process going on. Recently, I was in Lahore, I think last year, I think it was, and we went to one small private hospital, which I won't take names, but I honestly thought that, oh, it's a bit of a joke. They should not be they should not get accreditation for training because they haven't got their specialty sorted out. How their ICU is a bit of a joke. But there was a whole CPSP training committee. They all had those chais and samosas, and then later I heard, oh, that college has now been accredited. So now that college has been accredited, that hospital has been accredited. Now it should be audited regularly. That if they're delivering, because yes, maybe at that time they did not have that facility because the hospital was new, but they should be regularly audited that whether they're developing that infrastructure. Training assessment is the other thing in terms of documents. So training assessment is those mini key access, CBTs, case-based discussions. If you haven't got that as a part of your formal training, which I believe that most of you don't, please make a habit. Create a form for yourself. If I have learned anything in the last 4 or 5 years doing specialist assessment, is that every freaking application is individual. I could have a same outcome from a very same training from a very same hospital substantial, and for a very similar different training as a non-comparable. And then they question कि मैंने तो उसका form copy किया था. Why am I non-comparable and he is substantially comparable? You tell me. Because it's individual. He may have done the application form better. He may have been able to justify everything very well in an interview process. It's very individual. So please that individuality, that health of your application is based on nuances. If you have got that documentary evidence with your, case-based discussion, your logbooks, and your, certificate of completion of training, everything should be there. Now, other thing which people just completely get a little bit confused about is CPD, or continuous professional development. That how do we do that? And by definition, most of the trainees are bound by law, by Pakistan Medical and Dental Council or Indian Medical Council or their local state medical council, to have certain number of hours towards their own self development. Okay, there should be conferences, workshop, courses. Make sure that whenever you do attend conferences, workshop, courses, or any online sort of workshop, please get a certificate. And that certificate should have your correct name as it's mentioned on your diploma or degree of MBBS, and number of hours and the dates. Okay. And then that's fine. That's submittable. So your CPD activity should be relevant to your own medical specialty. You cannot say that, oh, I've look like, I mean, next in September, I'm attending a conference which is called Creative Careers in Medicine. Now, the Creative Careers in Medicine is all about, how else you are creative apart from medicine, which is very important for me because I like doing these things which I'm doing it right now. It's a creative aspect of my personality, but it's got nothing to do with emergency medicine where I'm consulting. So and I'm not going to use that as a CPD documentation when it comes to my annual CPD requirement. So make sure whatever the CPD requirements you're doing are relevant to your own specialty, especially for the purpose of college application. So if you're a pediatrician, make sure that your CPD activities online or in person or face-to-face courses are all relevant to pediatrics or general medicine for that matter. Now, general medicine is good because you can pretty much extract everything. It could be neurology, it could be cardiology, it could be counseling, it could be anything. It's a huge range of things. So CPD certificates need to be there. There's also other submissible documents when it comes to your own departmental meeting. Now, some of you have got this responsibility of attending the departmental meetings. Now, that departmental meeting could be anything. Could be, I remember when I was a house officer, there was a weekly neurology and neurosurgical departmental meeting. The neurology will bring 5 cases, neurosurgery will bring 5 cases. They will discuss these cases. That was a department meeting. I think if you've got something like that going on in your own department, in your own hospital, in your own practices, be it private or public, make sure that you've gotten evidence saying that we have these regular meetings, interdepartmental meetings throughout the year, lasting for about 1 hour. And this is the documentary evidence of that. Your professor can sign it, your consultant can sign it. This is very important. Everything is actually putting more meat on the bones. So college can chew that meat instead of chewing you and giving you a non-comparable outcome. Okay, all right. So, and then again, CPD certificate, nobody's got time to review every certificate in detail. You need to produce a transcript, like a table kind of thing, and cumulative total, and then submit the CPD certificate as an additional sort of PDF scan thing, magically. Now, the topic number 3 is interviews. As I said, in my recent assessment, I think interviews are getting a bit more crucial. I've had people from Pakistan, especially gynecologists, who have got very good experience on paper, very good skills on paper, but when it comes to interview, they just do not perform. And when I just say few, I actually mean a majority few. There are very few FCPS from Pakistan. Now we've got partial comparability FCPS gynecology from Pakistan last week, which is, by God, I'm so happy because it was like a bad omen for some reason. Everybody would go with perfect looking forms and they would make a mess out of it in interview. And the non-comparable letters would come with this like 20 explanation. You said this in an interview when we presented you the scenario of an ectopic pregnancy. It did not look like that you've managed an ectopic pregnancy as a consultant. Like, what are they saying? Despite the fact that we have trained and coached them in an interview. But trust me, these interviews are quite extensive. And I'll give you an example. Um, some of these interviews would ask you about a media policy, social media policy. because it's a clinical governance issue. They will ask you a question about, oh, what if there's a photos being leaked of the patient? What would your strategy be? Somebody would ask about the clinical governance procedure of complaints handling. If you've ever had a complaint, now that's not a good time to think about a complaint during the college assessment interview. You should have an example ready. And what did you learn from that complaint? Sometimes they get scrutinized on the details and the depth of the audit that they've done. Now, that's not a very good time. I was preparing one doctor for a RANSCOG interview, and she had listed 3 audits in her application of RANSCOG. Trust me, when I asked her about the 3 audits to explain me the one of the audits that she's done out of her own choice, she could not explain to me. And I said, you've done these 3 audits. I've asked you, tell me about the final, you know, summary of the best audit which is closest to your heart. She could not. And I said, man, like, how are you going to go and pass this? And if they ask you to explain your thesis or dissertation for that matter, and if you're not passionate about it, if you've not done the research, if you've done this khana puri, then, it becomes a bit of a trouble. So trust me, prepare for these things. I know that you've taken a significant effort in preparing for all these projects as a part of your training. Just make sure that you're able to explain them in a very succinct way. Okay. So interview, what are these interviews about? They're about your training experience. That is the vocational training experience. That is about your exams, because there's sometimes a bit of, bone of contention. Oh, were the examiners internal or external? Okay, because if it's not external, then how? Because in India, apparently every year you do the yearly internal exams and end MD exam, which is external examiners within the state or something like that. In Pakistan, obviously, we get external examiners as a part of the CPSP assessment process. So make sure that you are mentioning that when you're explaining your exam. And plus the component of exam, if it's an MCQ, if it's an SAQ, if it's an OSCE, you need to describe everything in detail. How many stations were there? How many cases were there? What kind of cases were they representative on the core ethos of your curriculum? So devil's in the detail. Proof is in the pudding. That kind of detail and depth is required. Um, Now, I was talking to one of the college assessor for Australian College of Emergency Medicine who works with me. Um, and I was asking about these clinical case scenarios which come up during these specialist assessment processes quite randomly. Sometimes they get asked, sometimes they don't get asked. And she said to me, as per APRA, or Australian Health Regulation Practitioner Authority, or Medical Board of Australia, we are not meant to be asking clinical case scenarios. Not meant. But not meant to be asking and being asked are two completely different things, because in my practical experience these are being asked sometimes quite regularly. Like if you are a radiologist and you're applying for area of need position, then definitely they will show you some CT scans and MRI scans, because you are by definition working in a remote location where there is a lack of supervision and they want certain competencies, and their best way of checking for those competencies is just giving you a few scans. By same definition, dermatology. Historically, dermatology does only that. They do clinical scenarios only. And I've talked about that in my previous consultation as well, that their interview lasts for about well over an hour. And they only ask about, oh, if the person comes with you with this rash or an allergic manifestation or this kind of thing, what is your diagnosis? And don't even show you the pictures. And how would you manage that as a consultant? And then you have to say, okay, fine, now I have to identify, I have to biopsy, and I have to do these kind of stains. And then based on that, I have to start on this treatment. I have to follow them up and I have to counsel in this, all these kind of things. So be ready with a various aspect or multifaceted clinical scenario in which the clinical component would be one thing. There would be some administrative component as well as in terms of social component or some cultural competency issue as well. So they are complicated scenarios, especially I've seen very complicated scenarios being played out in gynecology college. We've talked about CPD and we've talked about publications. Make sure that you're ready to explain to them in a very succinct and short way. Nobody's got a time to listen to your 20 minutes worth of explanation on your publication that you've done. Yes, you may be very passionate about that publication. It might been awarded some local award, but you need to present that in a way which is very short and sharp and sweet for them to move on to the next point. Teaching, as I've already highlighted, your teaching needs to be formalized. Gone are the days when you say, I'm passionate about teaching, I'm involved in teaching. These are not the words which stand the tooth of time or testing of assessment of specialist courses. You need to show, I am an invigilator, I am something of a substance. I've got this title. Why? Because if you look at the RACS, Royal Australian College of Surgeons, entry assessment criteria into the surgical training, teaching carries points in the actual entry of the training program as an ENT surgeon, orthopedic neurosurgeon, and whatever it is. And those points are bloody hard to achieve because that involves working as a conjoint lecturer in a medical university. So how can they, if you, one of you are like RACS assessment process, how can they let you go, I'm involved in teaching? So you need to make some efforts, and this would be time to formalize those teaching points. Now, let's come to the elephant in the room, which is the jobs. Normally, most of the colleges would have jobs assessment, sorry, the comparability assessment outcome. Okay, so the comparability assessment outcome before that could be partial comparable, substantial comparable, means different things in different colleges. In RACP, which means College of Physicians, Medical and Allied Specialty, there is no exams. Once you're found partially comparable, you're partially comparable. There might be top-up training and peer review assessment. Top-up training time means that, okay, fine, you need to work as a senior registrar. You'll do that for 12 months. And then peer review, you'll be working as a consultant kind of thing. And that is a peer review, that your peer, your consultant will review your performance as a consultant, even though you'll be getting paid as a senior registrar, whatever. And they will say, yes, he is actually a good consultant. He's doing a ward round independently. When he's on call, he's actually quite good being on call as well. Okay, so that peer review assessment process. But for College of Surgeons, a partial comparability outcome would be quite different. They may say, oh no, you have to do operating with respect module online. You have to do, the top-up training of 24 months. You may have to do actually now a final exit exam, which may include OSCE component. Recently, we had a substantial comparability outcome from someone from Amman, Jordan, in general surgery who had a substantial comparability outcome with only 6 months of peer review assessment process, no training, no exams, nothing. And he had done Arab board from Jordan. Good consultant experience, good training experience, nothing out of the world. That's what I'm saying, that you don't have to be like a super high achiever. You just have to be diligent. You have to tick all the boxes. All right. And unfortunately, there are many boxes to tick. So comparability assessment report, even if, so people often ask me this question that, oh, can I be partial if my training is 3 and if my consultant experience is this much and I don't want substantial, I want partial. It doesn't work that way. You should all be aiming for substantial and then you'll be given a partial. Okay. And then people ask me, oh, would I be working as a consultant? No, 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 no. One thing I'd like to very openly clarify for each 264 of you who are in this meeting. A specialist pathway will take for whatever college an average of 4 years to complete. Make no mistake about it. You're in for a long haul. It's not like you got a partial or substantial comparability and next year you're on specialist registry with APRA. No, 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 no. There will be training requirements. There will be some exams. There would be assessments. You may not get through those assessments immediately. You'll be on limited registration, which is a registration equivalent to that of okay, your level of supervision would be high, but you'll be on limited registration. And until you fulfill all those requirements, be it top-up training, be it a peer review assessment process, be it further exams or whatever it might be. Sometimes it is more research, sometimes it's more child protection that you may have to do or something or the other. So you have to do so many other things. So on an average, it will take you 4 years, 3 to 4 years. It's not a quick fix. That includes, getting the college application, getting the college interview, getting the job, and getting you across. Now, in the global scheme of things, if you ask me, those 4 years are nothing. You've already completed training program. In those 4 years, 2 years, 1 year, you'd get to the application. You've got 3 years left. You'd be getting paid as a senior registrar, which for most of the people, I think, would be good enough to sustain yourself and a family. And you'll be working at least in Australia. But at the end of the 4 years, the rewards are big. You're on a specialist register. You can now work independently as a consultant. Yes, there might be moratorium restrictions depending on your specialty, but still, you're on a specialist register. You can apply for independent permanent residency if you're less than 45 years of age. If you're above 45 years of age and you're a specialist, more the hospitals in the region would be hunting for you. And they'll say, okay, fine, we will sponsor your permanent residency, even if you're above 45 or 50 years of age. I've seen that play out countless times. So jobs will take about 1.5 and 2 years. Now, why do I say that? I don't say that lightheartedly. I say that factually. There was one radiologist from India who I recently shared a story of as well, who I thought, to be honest, was brilliant. He was well spoken, good training, MD radio diagnosis, good Middle East consultant experience in Oman. It took him 1.5 years to find a job. He's finally got a job in Newcastle, very close to Sydney. Very good job. I'm not sure if he's let go of some jobs, but finally it took him 1.5 years. One pediatrician took her from Bangladesh. In fact, one of our first pediatric application from Bangladesh uh, took about good 1 year and 6 months to find a job in pediatrics. That job, which was specific to that um, requirement of a comparability report, which was partial comparability report. Um, there was another one who was that anesthesia, but that, I mean, that case was different. There was an anesthesiologist from Pakistan, FCPS, who was able to obtain a job in 6 months. Now, she was very persistent. She got a job in Sydney after the comparability outcome of partial comparability. So partial comparability, I want to make sure that, look, it's nothing bad about partial versus substantial. It's your proactiveness. And the reason it takes 2 years, it's because these jobs are not in a majority compared to the junior doctor jobs. You are applying for a top tier pyramidal level jobs, by which it means that you will struggle to find those jobs, number one. Number two, it will take around to get yourself used to the particular temperament of an interview and application process. It is a process, right? You get used to, the sooner you get used to it, the better is it for you. And more or less, now there are certain specialties, don't mind saying, emergency medicine and GP, which jobs are not hard. People are able to get job even before the comparability assessments. That is the thing. Okay. So emergency medicine, if anybody of you done emergency medicine MD or FCPS or Arab board, very good future here. If you've done GP, MRC GP or whatever it is, with obviously the CCT or completion of training back home in your own country, then you've got good job chances, like less than 6 months. I haven't seen an emergency physician waiting for more than 6 months. And most of them, if the training is good, even as I said before, that there was one doctor who, even without the consultant experience, was found to be substantially comparable because of his fellowship in the U. All right. Okay. Now, what if the comparability outcome is negative? Now, that is obviously not an outcome you were expecting to, and you may have done your level best. However, that's the way things turned out to be. Uh, Look, often when it's non-comparable, they give you a very detailed explanation why it's non-comparable. There might be some training lapses, there might be some assessment lapses, there might be some specific interview issues. You will get the bar of it. Like, it won't be something immediately that, oh, I was not expecting that. Yes, sometimes it is. Sometimes I have seen that play out as well, that, okay, the preliminary report was looking very favorable, and then that bomb drops, so you're not comparable. So in that point of view, you need to be mentally prepared that it's not the end of the world. Okay, you can address those specific issue in a year's time. Sometimes with the College of Physicians, there's an expiry date onto these non-comparability report outcomes. If you're set in your pathways in terms of coming to Australia, which I think is still good option for the next few years, then either you can address those specific issue, and by God, your chances are better when it comes to the reapplication. Now, I did have many people who have been found non-comparable. There was one person from India in radiation oncology. She was found non-comparable. There were specific issues. We highlighted those specific issues and relaunched her application about a year. She was found partially comparable. She's still looking for a job, which I feel for. It's not her fault that she's not been able to find a job in radiation oncology. It's just one of those rare fields. So yeah, that's the thing. Now, one of the things which get asked about, like, What does it matter? Like what how can I improve my job chances if I'm a specialist? Well, your experience, if you that's where it hits home. And I've seen this play out all the time. If you're a young consultant with a good consultant experience back home in Pakistan, India, Arab countries, if it's 4 year plus, trust me, you won't struggle for a job unless and until it's a very niche specialty, like completely ridiculous, like EP physiology or radiation oncology. I've just said, if you've got 4 years plus, good tertiary level experience, you're able to present yourself well, you're authentic, you're through and through pure, you know, you, कोई मिलावट नहीं है इस डॉक्टर में. So then you will get a job. All right. So you need to make sure that you are authentic, and people pick up the authentic thing. You speak one sentence, I can tell you that look, you're genuine. And they can do that because they interview hundreds of them every day, overall. So experience counts, and if you've got good consultant experience, good scope of practice, good operative hand, definitely. Now, what about the short-term training? Because that's where now people are relying heavily, that, oh, look, I can come into short-term training. Maybe my training is not as good when I was in, and I can compensate for some of the deficiencies in my training. Maybe it's just good to move to Australia right now, and then apply for specialist assessment. That's all good and reasonable. I often advised it. But now I'm advising that please join, and there are fellowship programs which you get training and short-term training goals. They're advertised on the internet for the particular faculty of your college. Yesterday, I was talking to one of the surgeons from Ireland, and he was asking me, "Oh, I need to come in through short-term training," and I was able to identify a website with all the fellowship jobs in there. Now, you should only consider short-term training program if in your core training you do qualify for specialist pathway. There is nothing in your training. If you want my advice, that's my advice. If your application is so good that even if you lodge your application, the chances of it being partially comparable are more than 90% to short-term training. Your chances of now converting that partial outcome into a substantial one are much higher, number one. Number two, you don't have to worry about leaving after 2 years to go back to your country. You can leave, you can apply directly for, a specialist assessment after completing those 12 months or 24 months of short-term training, be it in whatever. And now short-term training are also bit challenging when it comes to certain specialties, dermatology and radiology and medicine. There are no short-term training jobs. I haven't placed anyone in medicine as a short-term training. Sometimes they do get lucky. I have got a couple of participants who are working in some regional hospital as short-term training unaccredited registrar. That's fine. Yeah. So there is a possibility, but by and large, if you want to make it authentic, do short-term training. Now, recently there was a participant from, as I said in the beginning of this session, Santiago, Costa Rica, sorry, Costa Rica, who did short-term training in radiology first. And even though I believed myself that her application is not strong, but she sent me an email today. I'll share it on my Insta and my LinkedIn. She was found partially comparable. As to how much of it was compensated, and her specifically, the training component was that she did not have an exit fellowship exam. Now you would be gobsmacked that how come Ranscar gave someone a partial comparability outcome without an exit exam? I don't know that. As I said, more I do this process, the more I believe it's individual. She's an extremely good communicator. She has not got a exit fellowship exam, but she's got component of assessment throughout her training. Maybe she was able to convince them on those components. So yeah, that's the thing. So look, overall, in summary, detailed application, comprehensive application, not detailed, comprehensive application. Make 2 to 3 drafts, match them with the curriculum. Make sure your documents, they are your responsibility to make sure whatever you written in the application, they are proven by your documents that you're providing, logbook, CPD activities, certificate, letter of support. Please make sure that you are able to talk like a consultant. There is no point of doing this entire exercise if you don't if you cannot communicate like a consultant, for some of the junior doctors, it is junior consultants right now, not junior doctors. Junior consultant might be an issue. As I said, that Pakistani gynecologists unfortunately don't have that kind of skills acquired as yet. So they need to spend some time improving that. And it comes with confidence. The more you take charge, unfortunately, our systems back in our own country are very hierarchical. There's no mentorship. We don't get encouragement as a trainee, which defeats the purpose of you know molding you as a good consultant, which is what you need when it comes to the other countries. Trust me, it carries with you long way. You can pass your exam, you can do the college assessment processes, you can get jobs faster if you've been mentored correctly. So make it your own responsibility. You get to that stage, and if there's some someone not helping you in that process, find someone who will. All right. And jobs are important, and obviously they're not immediate. The colleges don't have any responsibility on job. Then you have to make sure that you apply for jobs broadly. And one thing which I'd like to say, I don't know how many. There's so many chat, like there are 90 chat box messages. I'm not be able to review all of them. But look, if you've done membership exam right now, none of the membership exams from the UK count towards a specialist assessment unless and until you've done um, certificate of completion of training in the UK. So please don't ask me this question, that does any of the membership exam count? If you've done membership exam on top of your FCPS or MD training, fine, whatever. But membership exam right now, if you're thinking about the specialist assessment process, they're not a part of your assessment. All right. Now I'll take one by one interview and I'll unmute the person. If you can just raise your hand on just basically because it's 280 of you here, 255, sorry. I will only be able to unmute the person who are I'm physically able to see their doing their hands. So please bear with me and I'll take some questions. All right. So Dr. Faisal has been very diligent. I like his face. He's looking very patient. So I'll ask him to unmute, Dr. Faisal, and I'll take your question if you got a question. If you don't have a question, we'll move on.
Well, actually, I didn't prepare any question, but anyway, thank you very much for having me. Uh, I just want to ask that I am a FCPS anesthesia. I'm working in Middle East, a very good tertiary care hospital, in fact, a top tertiary care hospital as an assistant consultant anesthesia. Uh, and I'm working since last 6 years here. Uh, and I'm adjunct assistant professor in the affiliated university as well. So I'm just going through the process. I have done OET as well, and I'm just doing documentations, all these things. My question is that how are my chances that,
Your chances are
well,
good. Your chances are good. College of Anesthesia or Australian New Zealand College of Anesthesia requires 6 years of training, which includes your internship. After that, 4 years you would have done an FCPS, right? So that's
I
almost
have
5 years.
done, I
And
have, sorry, excuse me, I have actually, my training finished in 2015, and then afterwards, the FCPS tour takes a bit time to pass. I did multiple attempts in that, and then in 2019 I
what?
got pass in that,
Okay.
and after that in 2020, after doing some kind of experience in Pakistan, then I landed in Riyadh King Faisal Specialist Hospital. That's a tertiary care hospital. We are doing all kind of surgeries here, and
Yeah.
I'm involved in anesthesia.
So good,
So
Dr. Faisal. I think we'll just keep it brief. If you have got 6 years of training, and you've got now good capacity of full scope of working in a good tertiary level hospital, which you say that you do, with the only and the most important caveat being you need to have a good application and a good interview, because none of it will matter. And I've seen plenty of these examples play out. And then they say, oh, my application, my money. So yes, if your application is good, if your interview preparation is good, these are very strict process, because now we've got lots of SIMGs coming in and the process is only going to get harder. So definitely you do qualify on paper. Whether you put it into best use, definitely. And there's a good need for anesthesiologists as well. I'll move on, if that's okay, to another doctor,
Yeah,
and
thank
that
you.
is Dr. Abhishek, I'll say.
Hello, good morning, sir. I'm Dr. Abhishek. I have done my MD in radiation oncology from India, from AIMS, and I have completed my training in 2024. After that, I have done my senior citizen in Tata Medical Center for 1 year and 9 months, and right now I'm working as an assistant professor since last 6 months. So, because I did not have a lot of information about radiation oncology, how to approach, would you be able to guide me?
Yeah, I will be able to guide you, but radiation oncology, look, I've already got one participant who is still looking for a job. That does not see, based on my anecdotal evidence, that you cannot get a job. Radiation oncology is one of those fields as raised as hen's teeth. So, it's getting the comparability outcome is one thing, but getting a job in radiation oncology, you have to mentally prepare yourself that you have got a good consultant experience. And the current candidate that I've got, she's got a very good consultant experience. She's working somewhere in Saudi Arabia. Um, Now, lots of these job factors, as I always believe, and that's my very strong belief, they're very individual. You might not be interviewing well. There might be something which you're tripping off something. So if you've got a good consultant experience, you've got a partial comparability, then yes, definitely. And I'll be more than happy to guide you in that regard.
Thank you.
Okay, next person I'll ask the question is Dr. Fatima. Okay. Thank you, guys. We'll just keep it brief and we'll keep on moving. I'll ask Dr. Fatima to unmute, and yes, we'll take it from there.
Yeah, thank you so much, Dr. Rizwan, first of all, for your detailed, very informative talk. It was of great help. Quickly, I will go through my case. I'm FCPS OB-GYN. I did in 2015. After that, I'm RCOG. So my initial 5 year experience is from Pakistan. Then I moved to UAE. Currently, I'm working as specialist in OB-GYN in one of the leading tertiary care hospital in Abu Dhabi. The thing, because it's a surgical field, OB-GYN. So my question is,
বলছে রেডিয়েশন অঙ্কোলজিতে
what are my
jobs
chances?
একটু পাওয়া মুশকিল
Just
ওখানে senior level consultants
okay, sorry about that.
No, no. So what are my chances of getting comparability, considering that I was doing all kind of gynae procedures during my training and also in Pakistan, but I'm not sure if you're aware, but when you move to the Middle East and in UAE, you as a specialist, you are not allowed to do all the gynae procedures. Like, I'm not doing independent laparoscopies or the gynae surgeries. Although, as far as the obstetric side is concerned, I'm doing very extensive all kind of obstetric procedures, handling all obstetric emergency. But this gap of gynae procedures that I'm not doing independently, if I put extra effort, maybe I'll be going from my off time and assisting consultants, but still I won't be able to show in my logbook that I'm doing all these procedures independently. So should I start to go and try my luck? But it's a surgical field. I feel like, I mean, what are
I
my
got your
chances?
point. I got your
Yeah,
point. So,
thank
Dr.
you.
Fatma, first of all, I'm very glad to speak to you and hear you. At least you communicate very well and
Thank
you present yourself well. So, I think that's to your advantage. Number two, you've got uh, an issue which is a universal issue, that yes, there's a lack of laparoscopic skill and hysteroscopy, colposcopy, level one, two, three. Um, and then there's sometimes a lack of what they say, gynae onc exposure, some ultrasound exposure in terms of dating scan. The RANSCOG assessment is quite detailed and comprehensive. There's many components to it. Now, we have been able to get an FCPS partial comparability outcome, so that can be done with the same training program, which is driven by CPSP on a very similar level to you. Um, as I said, look, these processes are very individual. Having no experience, I would say stop right there and please don't bother in laparoscopic skill. If you've got no experience, don't even bother. Okay. If you've got no communication skills, please don't bother. It is not worth $8,000, $9,000 Australian dollars worth of an exercise to see and test if you got money to burn, definitely. But please, if you do tick up boxes to some degree, to some level of spectrum, it's worthy, and definitely improving your experience for the sake of application, even consolidating all their experiences and assistances that you've done. Yes, it's worth it. But if it's not something you can do, then wait for it till you can show them on paper and then do it. And it's a very extensive process. Rank Scock is not an easy application. It's a very serious application for me, because it requires so many things. Their interview is extensive, their documentary piece is extensive, the logbooks are extensive. When it comes to CPSP, I spend more time with Rank Scock CPSP than I spend with MS OBNG with India. At least because some of these modern Indian hospital, they've got laparoscopic skills throughout their training program, and they've got their local fellowship, which is FMAS fellowship. Even though their experience might not be as extensive, at least they're able to show that exposure. Anyway, I hope this answers most of the questions for the gynecologists as yourself and others. I'll just mute yourself, guys, when you have asked your questions so I can quickly move on. Okay, so I'll now ask the question from Dr. Yi Lin Hatut. I'll ask to unmute, please.
Hello, Dada. Thank you very much for your sharing information. I'm gynecologist, originally from Myanmar. Actually, our training in my country is 3 years, but in the last year of the ACT exam, unfortunately, I didn't well. I didn't do well, so I had to stay for another 6 months. So my total duration of training was 3.5 years, 3.5 years, and after 1.5 year of supervised training, I like it with as a specialist. I attended the fellowship training, which is a clinical fellowship in gynecology endoscopy in Thailand. It is a well-established center in Asia Pacific region. So during that fellowship training, I had a lot of exposure for laparoscopic and hysteroscopic surgery, and I can do independently very well. Since 2023, I'm currently working as a consultant gynecologist in Maldives. So I have passed the MRCOG Part 2 and now I'm preparing for MRCOG Part 3. So I want to know my eligibility for the specialist pathway for the assessment of the
Okay.
right college.
No, I
Yes.
understand that. Thank you. So basically, 3 years of training experience back in Myanmar, and then obviously 3 years of further experience in Thailand with good laparoscopic skills, and now working as a consultant. So look, overall, it sounds very good on paper. Now, there are certain rules to obey and follow that, look, you should have been trained in a country, and
Yes.
then you should be on a specialist register in Myanmar, and entirety
Yes.
of your training should be in Myanmar. So if that's not the case, then the overall health of application becomes a little bit shaky. That if you've done first 3 years in Myanmar and then you've migrated to Thailand to get some additional experience to compensate for that 5 years of training. In fact, if you jump onto Ranscog website, it's now 4 years of training that they're requiring. Okay.
Yes.
But then again, if you've got some 3 years, initial 3 years in Myanmar, and then further 3 years in Thailand, and then now working in
No, not
consulting.
3 years in Thailand. In Thailand, it is one year and 2 months.
Okay, 1 year and 2 months, and then further now working on Maldives with no experience of training or consultant experience in Myanmar, that country, then it becomes shaky. Now, I'm saying that it becomes shaky, but overall, how it translates can be very individual, because you can identify that, look, in Myanmar, resource poor country, but I did not stop there. I actually moved where I can learn and acquire more skills. As I said, fellowship experience always comes to the rescue. So if you're able to portray that you've got a good logbook, you've got good letter of support, and because of the deficiencies, now you've acquired some skills. Now it's not straightforward, it's shaky, it's risky, but there is some hope, some hope. Overall, that hope is very minimum, but there is some hope. I hope it makes sense. But it depends on many different factors, and if you communicate well, then that's all good.
Yeah, thank you very much.
All right. Well, now we'll go to Dr. Debashish. I'll ask to unmute. Okay. While Dr. Debashish is trying to unmute himself, I think we'll take another question. Oh, hang on. He's unmuted. Okay, Dr. Debashish.
Uh, Thank you very much for agreeing with the call. I am Debashish from Bangladesh. I have completed my MD degree, which is 5 years academic program in dermatology. Now working as a dermatologist in Cascade Government Hospital in Department of Dermatology. Uh, is there any chance would be there my uh, opportunities in the social pathway if I
Okay, I got it. I got it. I
want
got
to
it.
proceed?
Yeah, I got it. So, Dr. Debashish, dermatology is one of the very competitive specialties. It takes an average about 4 years to 5 years for an Australian medical graduate to get onto the dermatology training program. A lot of publications, sometimes people even do masters. You are up against a very big hill. Okay. The college assessment process, again, very strict. We have got good successful outcome with one participant from India with MD in dermatology. I think she's still looking for a job. The if you go to ACD website, Australian College of Dermatology website, they've actually put in the time, how much time you'll be looking for a comparability assessment process. It takes at least 1.5 to 2 years for the comparability assessment process, number one. Number two, their interview is quite ruthless. It is entirely clinical. It's like doing another fellowship exam. And number three, after even the comparability outcomes is successful, it will take you an average of 24 to 36 months, even depending on your comparability outcome, because jobs are just few. There's only 20 spots of trainee dermatologists in throughout Australia. So if I was to sort of, give you a quick tip is that if you want to have this as a slow burner, take it side by side. Definitely it's worth it because the rewards at the end are quite good. But just remain that it is just the timelines here are completely astronomical. I hope it makes sense. Okay. I will ask Dr. Madiha Naeem, I think, and then Dr. Zishan Ahmed would be the next one.
Hello, my name is
I can
Dr.
only
Madhya
take
Naik.
questions from the people who got the video on because I don't know who's on and who's off. So please, if you can, that'll make my job easy. Okay. Dr. Silva, yes,
Hello,
you've been there for. So third one would be Dr. Silva. I'll just keep on writing the names. Sorry.
hello.
Yes,
My name is
Dr.
Dr. Madhya Naik.
Mhm.
I'm an ophthalmologist from Pakistan. My question is that have you ever completed or submitted a RANSCO application for any candidate? And apart from that, what the interview about RANSCO is about? Is it that general you told in the presentation? And also my third question, how well ChatGPT and AI are reliable for documentation or interview preparation?
Good question. So, Dr. Madiha,
Madhu.
Madiha, yes, Dr. Madiha, we have done an application for RANSCO for a colleague from South Korea. That was our
Okay.
first application. He was working as an assistant professor, associate professor. Obviously, he was substantially comparable. He's working somewhere now in Western Australia. The application is quite extensive. We have got a few applications that we're doing right now. In terms of your question, how reliable are ChatGPT or Claude or any other AI platforms in terms of application preparation? Look, there are three crucial documents when it comes to RANSCO application. That is the curriculum, RANSCO curriculum, and then what they call as minimum number of procedure. RANSCO minimum. You must have seen that, right?
Yeah, I've seen that.
Yeah, yeah. So
I
if
have
you are,
submitted my application. I am at interview stage. I've got an invite for interview.
yeah. So
So
you
I
need,
just,
yeah.
yeah,
So fine. So once you've submitted your application, keep in mind of those peculiarities about the required minimum number of procedures in a college curriculum, and you've been invited to interview. That's good on you. And I think in terms of preparation for questions, yes, you can utilize any of. But I think the most important aspect of interview preparation is going through your own training, matching it
yeah.
with the training, and going through your own consultant experience, matching with an expected consultant experience, and also go through some of the cultural competency, clinical governance, your thesis, project research components as well, because these are very important when it comes to describing you as a consultant. I mean, on paper, you're a consultant, yes. but on
Yes.
describing you
I
as a
have
consultant.
one more a small question that how much part of the interview is basically clinical, while they have said that it's not a clinical interview or a clinical assessment,
Nobody
and
knows
how
that,
much
Dr. Madiha.
yeah,
Nobody knows that because college may pull a rabbit on that day.
yeah,
So yes,
yes, yes,
by and large, it's your training and your consultant and your components of training. As per APRA, they should not be asking clinical question. But if they're not happy with certain component of training and they want to double check on certain details, they may ask you a clinical
yeah.
question. But it's not a
Thank
standard.
you, thank you so much.
All right, now we go to Dr. Zishan. I think there was Dr. Zishan somewhere, Zishan Ahmed, yes, okay. And then after that, Dr. Sylvia. And after that, we'll have Dr. Raghav. Okay, I'll just keep on noting these names. Yes, Dr. Zishan.
Hi, Dr. Rizwan. Assalamu alaikum.
Walaikum salam, Dr. Zishan. How can I help you?
Yeah, so I have a very specific question. I'll just shortly tell you about myself and then I'll ask the question. So I'm from India. I studied in India. I completed my MD pediatrics in 2018. Then I did 2 years of a senior residency. I did
Mm-hmm.
1 year of fellowship in PICU.
Mm-hmm.
And then I worked as a consultant in India for 3 years as a PICU consultant.
Mm-hmm.
After that, I moved to Dubai last year.
Mm-hmm.
Here I'm working as a specialist in PICU.
Mm-hmm.
So now the Indian degree is categorized as a tier 3 degree here, MD. And there's no way that I can become a consultant here. So I'm planning to get a tier 1 degree. Australia is one on my lists. So what they want is a fellowship of the Royal College recognized by the Australian Medical Council. So does this specialist pathway lead to that, and how much time will it take if
Yes. So
I go?
look, good question. Thank you. I understood your point. So basically, Dr. Zishan's case is that he's a pediatrician. He's worked in PICU as a senior resident, and then he's worked as a consultant in PICU back in India. And now you're working PICU in Middle East as well, right?
Yeah,
Yeah, yeah.
in Dubai as a specialist PIC.
So now we have to sort of decide like where is your application sitting? Is it general pediatrician or is it PICU consultant or pediatric intensive care? So pediatric.
So actually, I'm open to both. I want to work as a consultant
No,
here.
hold that horse
Not that.
right there. No, no, just hold on here.
Okay.
General pediatric application is littered with what I call landmines. Okay.
Okay.
So landmine number one, community and behavioral pediatrics component exposure. Landmine number two, development pediatric exposure. Landmine number three, child protection exposure. Landmine number four, uh, community and behavioral. I think I might have covered that. So we need to, and plus landmine number five, which is the biggest landmine, is 3 years of basic pediatric training and 3 years of advanced pediatric training. So if you have got 3 years of specific PICU consultant after MD pediatrics, 3 years, yes, MD pediatrics. Now, how can I use 3 years of PICU consultant to justify the general pediatric exposure in terms of all those five landmines? That's the first few wheels coming off your application. It will be very much complex from that point of view. Then sometimes we are able to say, and this is not my word, it's from the college itself, that if you've got 3 years plus of consultant experience in good reputable tertiary level hospital with all those exposure on child protection, behavioral pediatrics and developmental pediatrics and all that kind of jazz, then yes, we can look into it. But in your case, PICU. Now, pediatric intensive care or pediatric intensivist is a separate qualification here in Australia. In India, NICU is a separate qualification. You do an MD or DNB in NICU. You do an MD and so pediatric. So I think right now your case, yes, you're right. FRACP qualification would be a good tiered level back home, back in Middle East, which will get you there. But your options right now are few. I would suggest to if you want to come here, do AMC1. Get onto the training program, get some recognition of prior learning, which is an animal which works. We have been able to obtain a recognition of prior learning for one of the emergency physicians from Sri Lanka who got 3 years knocked off from the training, which is good, good, good. And then if you get the training knocked off, then you can do a very shortened training program and go off with FRACB after doing all those components. And sometimes the components of exams are even knocked off. But right now at this stage, I think your application is neither in intensivist category, nor in general pediatric category, which might create more problems for you. Yeah. So then I'll move on to Dr.
Can I ask one
Rush.
more? Yeah,
I'll
there's
just, because I've got so
one.
many questions, I'll keep on asking.
Okay.
Otherwise, I'll be here. I'm sorry about that. But you can send in your CV to us and things like that. And Dr. Raghav, sorry. Dr. Raghav looks pretty desperate. He's walking and tossing here and there. Okay.
Yeah, I think I am unmuted. Thank you. So I want to ask a similar question like Zishan, but however, you have answered that one.
Okay.
So I will just brief about me and my
And
wife.
after
Together,
that,
we
I'll be
want to.
asking Dr. Arma. Oh, sorry, Dr. Sylvia. Why did I forget Dr. Sylvia? Yes, Dr. Sylvia. Dr.
So,
Sylvia and Dr. Arman
so
then after
about
that. Okay. Yes, please go
Yeah,
ahead.
hi. So about me, I have done 2 years of diploma pediatrics. Then I have done 1 year of fellowship neonatology. Then I want to pursue further. So I have done DNB pediatrics, which is a 2 year course because I have already done diploma
I know that
pediatrics. So
thing.
it
I know that
comes
thing. I
so
know that.
total 5 year of training. Then I moved to Middle East. So in Middle East, I'm working. This is my fourth year. I'm completing 4 years in Middle East now. So I moved immediately after my DNB. In Middle East, my current role from the past 4 years is I'm working both because I have a neonatology fellowship. So I'm working both in neonatology department, which is a level 4 in ICU, as well as a pediatric in both pediatric, general pediatrics and pediatric emergency because in Middle East you will have to cover everything. So it's
Mm-hmm.
like one day you are in neonatology and one day you are in general pediatrics, alternating that. So this is my current role from past 4 years.
I understand.
And when
Okay,
it
I'll
comes
tell
to
you. I'll tell you. I understood your entire case. Now, the first problem here is diploma. Okay. The diploma of 2 years, which I know is in the Medical Council of India, you can work as an independent consultant after that diploma in pediatrics. Unfortunately, we have had consistent trouble proving that diploma to be an authentic degree because here DCH in Australia is done by GPs, is done by emergency physicians, it's done by any doctor who's trying to get and acquire some remote pediatric experience. So there's going to be a little of little bit of work to prove that it was a curriculum, assessment, exams, and all that kind of jazz. So that's your first roadblock. Then DNB is
okay,
normally 3, but yes, for you guys, it's now reduced to 2 because if you're DCH, you have to then tie that into your. So 4 years. We are still missing 2 years. Now, 2 years in general pediatrics. Now you worked as a neonatal fellow back home in India. After that, diploma DNB combination, which creates again a set of confusion if you're trying to achieve a general pediatrics or neonatology because you're not trained as a neonatologist, you've trained as a general pediatrician. I know in India that being a general pediatrician, you can actually work as a neonatologist as well. But at the same time, there is a separate fellowship or DNB that you can do in neonatology. So there's someone who is
correct,
there with a college, and the college have done their application with a substantial partial comparability, who has done a fellowship or DNB in neonatology with a good amount of training. So when you come to them, they
correct.
will say, "Oh, wow. So what have you done with the previous applicant? How come he's done DNB in neonatology and you've come DNB in general pediatrics and now you've done a fellowship through a private medical college in neonatology? Where do we place you now?" So it requires a little bit of
Correct.
understanding in depth. And then your work is a bit of an amalgamation of 1 year and 2 year, and it just becomes a bit of a hot watch. So I think overall it requires a bit of challenge. I would suggest that align with one specialty, get more experience in that line, either go for recognition of prior learning or a short-term training. Even the short-term training doesn't save you in that regard. If you come here and do short-term training for 2 years, I've seen and dealt with one application working here in Sydney as a neonatology with a good 3-4 years worth of neonatology experience, non-comparable. So look, there
Okay.
is there's a meaning here which we need to identify. Dr. Sylvia, sorry.
Hello, Assalamu alaikum, sir.
Assalamu alaikum.
I'm Dr. Sylvia. I'm a FCPS specialist, obs gynae from Bangladesh. Now I'm working as an associate professor in a private medical college hospital, and I have 7+ years of specialist experience. But the limitation is I believe that I am so much expert in any kind of obs or gynae operations like laparotomies, but due to lack of my facilities in my hospital, I don't have much exposure to laparoscopic surgeries. I have observed, but I am yet not capable of doing independently the laparoscopic surgeries. So should I go for specialist pathways, or should I wait for some training? I have done the basic training, which was 15 days. So I don't think this is much helpful for
Yeah,
specialist pathways.
yeah, I don't
Uh,
think so either. I mean, if you have got a good enough consultant experience, and then in that consultant experience, because laparoscopy is an acquired skill in Pakistan and in Bangladesh. It's not a training embedded
yes,
skill. Unfortunately,
yes.
you, and quite rightly so, haven't been trained in laparoscopy, but unfortunately, in your case, even as a consultant, you're not doing that. My advice would be that if you can have enough, because that's what happened to our last partial comparability FCPS ops and gynae from Pakistan. Didn't have a training component of laparoscopy, but she had herself got herself an exposure in laparoscopic skills. So my suggestion, on honest opinion, would be don't lodge an application till you're able to compensate for that. Even as a consultant, you need a good logbook, and there should be a good representation of those cases as a consultant, so you can be at least in that.
Moreover, moreover, sir, I have AMC MCQ Part 1 also. So if it is possible that I secure a job through a standard pathway and go to Australia for short-term training for the laparoscopic exposure, it be helpful for this specialist pathway applications?
That's a big if, big if. So short-term training pathway officially is not a training pathway, and anything that you do,
Mhm.
you will not get as a part of training. That's number one. That's an official statement for short-term training. Number two is short-term training, and you getting a laparoscopic skills experience in that short-term training is very, very rare, because you'll be working in a hospital which is regional. There'll be already some gynecological trainees there. They will not let you. The reason they're giving you a job in a short-term training as a gynecologist is because they've got their emergencies they cannot cover. They want to train their trainees, they're not getting time. Their trainees are spending time in emergency doing deliveries and all that. So your exposure, I kid you not, your exposure would be very limited in terms of short-term training, and it
Okay.
will not largely
Then,
count towards the compensation.
okay, sir. Then how much training will be needed, or how much laparoscopic exposure should be needed to apply for specialist pathway?
I think download the
Like,
college curriculum,
okay,
Ranscock, and then look into it how
okay.
much. At least a few hundred plus.
100 plus. Okay.
Mm.
Thank you, sir. Thank
Okay.
you for the
Now I'll
opportunity.
go for Dr. Arman, radiation oncology. And then we'll go Dr. Saji, I think. Dr. Saji, who's radio.
Hello.
Yes,
Hi.
yes, Dr.
Can you
Arman,
hear
please
me?
go ahead. I
Okay.
can hear you, yes.
So I'm Dr. Arman. I'm from Bangladesh. I'm a radiation oncologist here. I completed my FCPS in 2014. You know that it was a 4 years training, and after that, after passing the FCPS, I was working as a registrar in a tertiary level private cancer center for 2 years, and
Mhm.
then after that, for as a junior consultant for 4 years, and all these 6 years, like register for 2 years and junior consultant for 4 years, it was a supervised position. And after that, I was started practicing as a consultant in
Mhm.
that hospital, and after 1.5 years moved to another tertiary level hospital where I worked as a consultant for the last 3 years, and then again last 2 years I'm working as a senior consultant of radiation oncology, and I have quite like around 20 numbers of publications, and so this is my situation. So what is your opinion regarding the specialist pathway for
Excellent,
me?
excellent. You should launch your specialist application without any delay. उर्दू में लफ्ज़ है ताखीर, बिना ताखीर आप अपनी एप्लीकेशन जमा
I
करा
understand Urdu,
सकते
but what about the job opportunity in radiation oncology from
That is,
from
sir, something you have to get the comparability outcome and then wait. If you're willing for that, then definitely you've got a strong application. With the only caveat, as I always say, it depends on the application, it depends upon the letter of supporting documents and everything, and then the interview performance. If you get a partial comparability or substantial comparability outcome with RANSCAR, then the job is a completely different animal, which we have to approach in a very strategic way. And yes, unfortunately, there are not many fellowship roles. Otherwise, I would have, I mean, you're more than welcome to go do your EPIC and AMC verification and English and start applying for fellowship position, because you are ready for specialist application. So if you are able to get a fellowship role, fine, but you are fine. I think
So
you do well.
should we do the English test first now, or should we proceed for
So
the
English
application
test is a
process?
requirement for every specialist application before you even start the application process. It is a
So
requirement.
I need to complete the OET
OET
first,
or
then
OET,
proceed for.
yes.
Thank you.
Okay, thank you very much, sir. Thank you, thank you. And yes, Dr. Saji, I'll go, and then we'll go Dr. Ahmed Anmar Shamsi, which doesn't look like Dr. Shamsi, but anyway, I'll.
Hello.
Yes, go,
Hello,
Dr.
Dr.
Saji.
Swan. Thank
Yes,
you.
yes.
I'm
Please
a
go ahead.
palliative care physician
Yes.
practicing here in India. I just completed my MD and doing my senior residency here in Jaipur in a tertiary care hospital. So I'm in starting of my journey for the specialist pathway. So I want to ask you whether to continue like this, complete my SRship and practice, apply for a consultancy position in India and then apply, or try for a short-term specialist pathway in Australia, or do the standard pathway or AMC like from here.
It's a very broad question, and I think if you have already completed your training, MD in palliative care, and you've got a senior residency experience, I think you should consolidate this experience with a consultant experience for a couple of years, and then you can apply for specialist assessment. And there are good opportunities in palliative care. I think you should not worry too much. But I think your application strength is in getting that experience. If you want to do side by side AMC, fine, that's okay. But I think for someone like you, who's almost more than halfway, two-thirds through the process, they should complete the full circle and apply for specialist assessment. All right, Dr. Shamsi. And after Dr. Shamsi, we'll go to Dr. Roy, Dr. Ann Roy, Ronya Ann Roy. Okay. Dr. Roy. Please go ahead, Dr. Shamsi.
So, Assalamualaikum. So,
Walaikum.
my husband is Dr. Shamsi and he has to go on a funeral. But we are so eager to talk to you. So, that's why I'm here on his behalf. I myself am a doctor. So, talking about him, my husband is a BDS. And after doing his 4-year BDS, he has done his 4-year MDS in maxillofacial surgery. And now he's working as senior registrar since last 4 years. And along with that, he has done his MDS epidemiology and biostatistics. So what are, and now we want to ask that, is there any teaching or research-based position he should apply on, or he should go for some clinical position?
Okay.
And what are
So
the,
if you, I think we need to create a very important distinction right here. If
Okay.
you're thinking of specialist pathway, you need to be consolidating clinical experience first and foremost.
okay,
That teaching line of action is not going to reward you in any way. Yes, it's good supplement to your specialist application. As I said, the teaching experience does count a lot,
okay.
but it does not replace the adequacy of the good consultant training experience. So definitely, if he's a maxillofacial surgeon, get a good consultant level experience and teaching experience, whatever he's doing, try provide that as a part of his application. Now, maxillofacial surgeon, again, somewhere in between dental, somewhere in between, maxillofacial,
Yeah.
max.
The-
So
the-
it's a very complex area and complicated pathway. And I need to have a look at things detail because the curriculum needs to be mapped out details. We have not done a max fax application before. So I need to
Okay.
look into this before I can make any further promises in that area in terms of logbook requirements, in terms of, by and large, the process is going to be the similar, but again, there are many nuances.
So the main question, sorry.
Yep.
So the main question is that, is BDS enough for proceeding? Is that because what we have
Yes,
heard that
yes.
you have to do dual qualification MBBS as well as BDS, and then they can
Yes.
accept as max fax.
For majority of cases, it's a dual qualification MBBS as well as
Okay.
BDS.
Okay.
But then again, I have to look at the curriculum, at the specific requirement, and then be able to advise.
So can we approach you via mailing you?
Yeah, mail is yes, definitely. But I think if you want me to definitely look into it, then definitely book in a proper career guidance.
So we
Yeah.
can book in a proper guidance, and then
Yes.
this guidance is still that we get through it.
Yes. So
Okay.
I can do a Zoom session 1 hour, look at everything, and then take
Okay.
things systematically. All right. Okay. Next
Thank
one
you.
up is Dr. Roy. So I was looking at Dr. Roy. Okay, asked to unmute Dr. Roy, Ronnie Roy. And then we'll go to Dr. Who was that one? I just didn't realize that there were so many people on three screens.
Hello.
Yes, Dr. Roy, please go ahead.
Hello, thank you for your next class.
Yeah.
I am just want to know about, I am a transfusion medicine specialist from Bangladesh. I
Mhm.
completed my MD degree in 2024, January, and now I am as a consultant in a government hospital. Can I apply for a specialist pathway in my subject as a transfusion medicine specialist?
Yeah, look, I think I have to look into it because this is something which is not a very common mainstream transfusion medicine specialist. I have to look which, first of all, is it RCPA? I think most likely it's RCPA, Royal Australian College of Pathologists. And there might be a certain sub branch in terms of hematology or laboratory hematology. So I have to look into it. So in order for me to give you an adequate advice, I have to specifically look into it and
Hmm.
then give you an adequate advice. I don't have any case or any um, uh, case analysis that I've submitted this application before, so I cannot give you any advice right off the bat. So yeah, definitely I can look into it, and I think I've seen this. Yeah. Now I will go to another Dr. Roy, which was just give me a second on first page because I just realized there were three pages of people. I thought there was only one page of person. And oh yeah, okay, Dr. Prabhita, let's do that. Dr. Prabhita, I've been seeing her face for a while. Okay, Dr. Prabhita, and then we'll go
Sir,
to
it is Pratibha.
Pratibha. Okay, sorry.
Yes. So, good morning.
Yeah.
I have done my master's in ENT and completed my master's in 2013. After that, I did a senior residency of 2.5 years. Since that, I have been working as a consultant, which has been like 10 years now. And I have also cleared a DNB ENT exam, which was OSCE and theory. Yeah.
Mhm.
So I have cleared the PT academic, and I have my credentials have been verified by the ECFMG, and I am in the process of applying for short-term training and got a few interviews as well.
Mhm.
So my question is, what does my outcome look like? Second, should I start with my specialist assessment right now, or should I wait? And third is, sir, that do you have any experience of assisting anyone who in the field of ENT who got a partial or some sort of comparability?
So first, we have got three applications for ENT right now. One is similar to you, very good experience, hopeful to get a good positive outcome. In terms of your second question, if you've got some interview in short-term training, I would definitely recommend doing short-term training before lodging your specialist application because then you'll have a local referee, some local procedures, some local exposure. That definitely adds value. Your application based or your credentials based on the things that you've provided MS 2013, 2.5 years of further SR experience and good consolidated consultant experience puts you well on paper and good number of publications. And then obviously with the only caveat being a good application, good supportive document, excellent supporting document and logbook, and plus, interview, you are safe, similar appearing safe. So definitely it's worth pursuing in your case.
Thank you, sir. I'll be talking to you via email then,
Okay, thank you very much.
and I'll book this thing, specialist pathway guidance. Sir.
Okay, it will be pleasure. Thank you very much. Okay, Dr. Saladi. Okay, he's been lying down. That's why I was like not paying attention that he's sleeping. Maybe he's just woken up. Okay, Dr. Saladi. Good morning, sir.
Sir, good morning. Actually, my cousin Srikanth Ramadenu, you might be knowing, he has done his specialist application through you,
Okay.
like internal medicine.
Okay. Okay.
Right now, he finished his peer review and he's working as specialist physician in Queensland, actually.
Okay. Oh, yes. Definitely. Oh, well done. Well done. Yes. I remember that.
Yeah, Srikanth Ramadenu, he
Yes.
has applied.
He is amazing. A very thorough gentleman. I told him that he'll have a good future. So I'm glad to know and get an update that he's doing a peer review now. Wonderful.
Yeah, he is my cousin only, sir, like my mother's own sister's son.
Mm-hmm.
Sir, right now I am also internal medicine, sir. Like I have 7 years of experience post MD.
Mm-hmm.
And my wife is a pediatrician. She's having 3 years post MD experience, sir. So we want to know about like a prospectus regarding specialist pathway for both of us.
Look, if you've got good post MD experiences, as you said yourself, 7 years plus, and it's just that thing that I've talked about earlier in piece in this, that we need to match that 3 years plus 3 years. We need to make sure that your components of training are that of an internal medicine and general pediatrics, which I call literally a landmine. If you do that, then yes, definitely you've got a good experience. And general medicine, pediatrics, both good specialties in terms of jobs as well. So definitely worth looking into. On paper, you sound good. In practice, whether it translates into a good outcome for you, it is to be seen.
Yes, sir. I like actually very happy about your service. Like Srikanth Ramdev has told you about you. Like
Yeah.
you take it's exceptional professional service. Like it's he has told me like if you are the guidance, like it will be very good. Like to go with you. Like sir,
No,
is my
thank you.
wife applicable for specialist pathway post 3 years experience like from India?
Not 3 years
Or
experience, because as I said, that mapping involves 3 years of MD, 3 years of SR, plus at least 2 years of consultant experience to have a good chance of partial comparability in general pediatrics. So might not be ready, ripe as yet, but maybe down the line.
sir, right now we got job in Oman, sir, specialist internal medicine and pediatry, MOH, Ministry of Health. So
Mhm.
will that be better for CV purpose,
Yeah,
like in
definitely,
Australia?
definitely. Middle East is
Okay,
a
sir.
good landing ground. All
So
right.
mostly like I will start my specialist application,
I think the connection got destroyed.
sir. My wife will wait for 2 years to apply for specialist application.
That's right. And yeah, we can certainly look into that. Thank you, Dr. Mahesh. Lovely talking to you.
Thank you, sir. Thank you.
Dr. Tanzila, just keep your questions short, guys, so I can move on quickly. Just a quick, yeah, please, Dr.
Yeah.
Tanzila, and then we'll move to Dr. Reddy, Surekha Reddy. Dr.
Okay.
Tanzila, Dr.
Thank you,
Reddy.
Dr. Rizwan, for the chance. So I have done my FCPS in 2019 in Obs and Gynae from Pakistan, and I have done with MRCOG exams. I'm currently working in a tertiary hospital in Middle East in UAE, Abu Dhabi. The same problem that we are having, getting chance to do the obstetrics here, but we are assisting this laparoscopy, hysteroscopy sometimes, but we are not getting the hands-on here. And we cannot leave the job here to go back to Pakistan and to get the experience. So I was so interested to follow the specialist pathway, but at the same time, I want to be realistic that it will be rejected based on all these things which we are not having. So I'm just thinking what could be the alternative, because if I am thinking short-term training pathway, then also many people are saying that you will not be getting the same thing which are required for the specialist pathway. If I'm thinking that to go towards standard pathway, so what will be the chances? Because I'm ready to take AMC. I don't mind to do hard work in, just like I want to get into some training
I got
pathway
it. I got it,
ultimately.
Dr. Tanzila. Fine. I read it. I am fine. Okay. So look, yes, you're right. Lack of laparoscopic experience. It's going to be tricky. You need to build laparoscopic experience, which is not there. There is, if you want to do and come to Australia, then I just sometimes ask this question during my one-on-one consult: how desperate are you to come to Australia? Sometimes people say, oh yeah, we just want to come to Australia. And
No, very much desperate, doctor.
okay, okay.
That I
That's
want to
that's
do
mostly,
anything. Yeah.
yeah, that's mostly the response. So then I say that, look, why, instead of reinventing the wheel, you might be burning out from ops and gynae point of view anyway. Why don't you come and do AMC? Why don't you join the GP training, which is only 3 years after doing some hospital work here, and become a GP with a special interest in gynecology? You'll still be practicing somewhat in your own area, while maintaining your interest in ops and gynae and working in a GP in your own practice. And there's good demand out there. So that is one pathway. But if you want to apply for GP training, sorry, RENSCOC training, that would be the other pathway, which would set you back another 7 to 8 years. So I was talking to one similar kind of person to you in my one-on-one, and I said to her that, look, there are two options. One is 4 years with permanent residency guaranteed in those 4 years, and opening up your own medical center or working as a GP with special skill set in gynae and ops. Or there's another pathway which may take you 4, 5, 6, 7, 8 years, with a very uncertain future, which is, training or retraining as a gynecologist here. The specialist pathway does not look like it's a possibility right now. Unless and until, so the decision she made was that quite clearly, look, I might as well just come as a GP, good job security, good income, and, GPs earn here more than gynecologists, especially. So, like, not all, like, I mean, obviously, gynecology is a steep earning curve, but I think majority of the GPs could easily rake up to between 350 to up to $450,000 in the first few years of their practice as a full general practitioner. And then you ask the question: is it all worth it? When I'm getting a permanent residency and salary of this stage. So this is more question. But if by any chance of luck you're able to, get a fellowship somewhere in Germany or UK, which is hardly a case these days, then it's a different situation altogether. All right, we'll move to Dr.
Thank you.
Reddy. Dr. Reddy, hang on, let me just locate Dr. Reddy now. Dr. Reddy. Just give me a second. Sorry, Dr. Reddy. Oh, hang on. I just had her on this page and then she immediately. Yeah, here we go. Yes, Dr. Reddy.
Hi, Dr. Rizwan. Thank you so much for the session. I'll not take much of your time. Just one question. I have been assessed as a partial.
Sorry, you got cut out. Yeah, go on.
Yeah, I've been assessed by Ranscock board as a partially comparable candidate. I have got 6 years of UK experience and they have given me the outcome with all the things that I need to, like tick box kind of thing, which I am confident with laparoscopies and the other procedures. But they have asked me to do some twin deliveries, I mean, breech deliveries, internal podalic version, which is not very commonly performed. Even in the UK, we were not performing them very frequently. So sometimes I get a doubt, like, can I finish the training or did they give me wantedly those competences which I couldn't finish? And maybe they are just using me as a service registrar and not progressing to the specialist. I'm just.
Yeah, look, I mean, this is what it is. If they've identified these specific issues, try to knock them off wherever you're practicing and get them signed off. If you're in the UK, right now in the UK, if you can go to India and get some exposure or during as part of the specialist process, you can, get a job in a large tertiary level hospital here and knock off those procedures. That would be good. But if the report has identified those specific issues, you have to do those specific issues to get the full Franz Cox status. There would be no bypassing that. And no, look, I mean, I think they may have, I haven't done your application, you've done your application. So if they've identified those issues, then you have to rectify those issues here in Australia. So definitely apply for jobs and address those issues to take it from there.
Okay, so is it worth applying for large tertiary hospitals than regional hospitals where
That's
these
right.
things?
That's
Okay.
right. Awesome.
Yeah, thank you very much.
All right. Dr. Ram, we'll go to Dr. Ram.
Hi, sir. I'm Dr. Ram.
Yes.
I have completed my neurosurgery, sir, basically, and I just wanted to know my chances. I'll not take much of your time, sir.
Neurosurgery and chances. I don't know. What who are you? What are you saying? Neurosurgery chances. What do you mean? Like, I've spent 1 hour telling you, have you got 5 years of training with
Yes, yes, sir.
and
No,
then
not 5 years. Basically, sir, I have completed my MBBS followed by my MS general surgery, 3 years from India.
Okay.
And after that, MCH neurosurgery.
All right. So that means that your total training experience is 3 years of general surgery and 3 years of
3
neurosurgery.
years of neurosurgery.
And then
yes.
how long have you been working as a consultant?
Last year, I have passed out in April 2025, my MCA.
Oh,
but there was no gap in my studies, like
Okay.
MBBS, MS, and MCA. Everything
Look,
is
you've got a
one
good
go.
profile. I would suggest to work as a consultant if you can. Then
Right now, I'm working as an associate consultant, but obviously, I'm not getting consultant job right now because I just passed
Yeah,
my.
that's fine. That's understandable. But
that's-
neurosurgical, you can understand. Look, it's highly competitive. There are like about 10 training positions or 20 training positions. Like, people would sell their kidney to get onto neurosurgical training program here in Australia. You've chosen a very good field, but unfortunately, it is something which you have to really work very hard. You can get fellowships, but then again, the chances even after the fellowship of getting a good comparability outcome depends upon how you are So yeah, get a good consultant experience and then take it from there.
So from here onwards, how many years of experience should I should target for?
I would say at least 2 years solid.
Okay.
2 years
Okay.
solid consultant
Then
experience.
down the line, 2 years, I will
Yeah,
contact
down the
you.
line, I'm here.
Thank you. Thank you, sir.
All
Thank you
right,
so much.
we'll go to Dr. Ryan. He's been waiting for a long time. Sorry, Dr. Ryan, go ahead.
Hi, sir. Can you hear me?
Hello.
Hello?
Yes, I can hear you. Yes, very well.
Okay. Oh, good afternoon, sir. Thank you for giving me a chance.
Mm-hmm.
Actually, sir, I did my following my MBBS, I did my MD pediatrics 3 years, followed by 2 years SRship, 1 year being supervised, and the other year being unsupervised in a district hospital. And following that, I did my fellowship of National Board in Pediatric Gastroenterology.
Mm-hmm.
After that, that was in India itself. And after that, I'm back in my home city. I'm working as a visiting consultant in a private hospital and
Mm-hmm.
doing a senior residency in a government medical college, but that is mostly an adult department. I am doing procedures on mostly adults as well as on children.
Mm-hmm.
So I want to know what should be the path forward and what are my
It's
deficiencies there.
look, your application and your credentials are quite unique. I would strongly encourage, if you want to go ahead with specialist pathways, to book in a consultation so I can have a look at your CV and logbooks and really map it out. Because, a pediatrician who's doing adult procedure, it's just I don't know what's going on in there. So I need to like really spend time and see what's happening. We'll go to Dr. Abhishek then. Dr. Abhishek Kulkarni.
Hi, good afternoon.
Good
So, a
afternoon.
little bit background about myself. I'm an orthopedic surgeon. I did my I did 1 year of SRship. I
Mm-hmm.
did one small short fellowship in arthroscopy and sports medicine. Following that, I worked as 2 years as an assistant professor in a tertiary care hospital in a rural setup.
Mm-hmm.
Then I have also done one more upper limb fellowship, and I have lined up two more short fellowships, one in Korea and one in Italy. So I want to understand what are my chances as a in the specialist pathway, and what do job prospects look like for an orthopedic surgeon?
Chances for specialist pathway and job prospects are two separate questions. So look, I mean, based on what you're describing, what I've already described, built on that, you need at least 5 years worth of training. And after that, you need at least for orthopedic, which is a very competitive specialty, I would say at least 3 to 4 years of consultant level experience with good logbook, excellent logbook, arthroplasty, revision arthroplasty. That's where the application falls behind for orthopedic surgeons. Arthroscopies and good trauma experience, emergency experience. If you've got all of that along with elective procedures in terms of arthroplasty and revision arthroplasty and arthroscopy, yes, your chances are good. In terms of getting a job, it depends upon, as I said, it takes on an average 12 to 24 months. That's how long the college application report of substantial capability or partial capability lasts. It is competitive. However, there are orthopedic surgeons who are working here. You won't come to know that is up until you start applying for jobs. And there are fellowship options here. So someone like you, I would strongly encourage to go hybrid, which means that prepare your application, start applying for fellowship position here in Australia, do the fellowship position in Australian hospital or with an Australian orthopedic surgeon in an area where you think that your curriculum is or experience is lacking, and then build it up from that point of view. Okay, we'll go
Thank you so
to
much.
look. I think time is coming to an end, and I know there are many people, which unfortunately I won't be able to address everyone. I would like to, I'll share the recording. So I think most of the questions you can have answered from that recording, discussing like there's still 163 people out there who have got their questions and queries. I'm really sorry. Speaking for 2 hours is not easy, as you can imagine. But look, send me your queries, book in a consultation. You can send me your CV and I can review that as well. And we'll take it from there. But overall, I'd like to end on a note that as I said, that specialist comparability assessment process is comprehensive. You need to match your application to your documentation, to your interview performance, and then at least have at least have 2 years plus of consultant experience. I think the question themes are repeating similarly, but the central ethos remains the same. I think if you're able to do this process yourself, by all means do that process yourself. You don't have to have my services or my help, although I like to be a successful part of all of your journeys, and we've got a team to support that. But definitely do that if you are able to do that. It's a learning process. It's on average, in my experience, takes about 3 to 4 years to become a specialist here in Australia. It is a grueling process. It is an expensive process. And it rewards commitment, it rewards hard work, because you're bypassing the entire 6 years worth of training, and it's well regarded. One thing I would say, which I constantly feel, is that some of very junior people who want to come to the specialist pathway, please don't waste your time in specialist pathway. Please don't waste your time in short-term training pathway. Consolidate yourself with at least 5 years plus of training. Consolidate yourself, if you can't do 5 years of training, with 2 years plus of training as a or 2 years plus of a consultant experience. Only then and only then you get a good chance of partial comparability outcome. If you're someone who's only done MD or MS last year or a couple of years ago and you got very sketchy consultant experience, then it's not worth it. It's not worth the money, it's not worth the hassle, and it's very stressful, and you all become depressive. And then somewhere here I saw a person who was psychiatric. We will all need a consultation from him. So all the best. Thank you very much. I'll share the report and the recording. Well, not the report, obviously, the recording. And I will do one more thing, actually, which I should mention. There is a blueprint course, a free email course, which I have done for all specialist pathway. And I think that will help you do that course. So it's an email which goes through specifically all the issues in terms of application, in terms of documentation, in terms of interview. Register with that course and it'll take you to the next step. So I'll send that course link to join after this along with the video, and then we'll take it from there. And all the best, my good friends and colleagues and comrades. I hope it goes well, and I'll see you shortly if you come across this way. Thank you very much and have a great weekend.